everyone, my name is Jessie Dobbs, and for those of you who do not know me, I am the Chief Information Officer here at Parker Adventist. I'm coming to you to kind of discuss a little bit of our new electronic health record system that we are going to be implementing here in the next couple of weeks. This is going to be a learning curve for everybody. I'm still kind of figuring it out myself, so please don't hesitate to ask me any questions. Shoot me an email, give me a call. I will include all that information here at the end of this video, as well as attached to the link that I'm sending out to everybody. All right, so as we begin this is going to be a major support system for our administrative staff. This is going to allow them to have all patient scheduling, patient information, and our claims processing all in one place. This is going to really make it easy for anyone in the hospital to access that specific patient's information. On that note as well, all patient labs can be submitted through this portal as well. So, doctors from radiology can send their results back to their primary care physician, as well as any lab work, x-rays, anything like that can be all taken care of through this system. You can submit all prescriptions, x-ray requests, lab results, lab requests, all in the same place, which is going to be super fantastic. Going to make it really easy and error-free is the hope. This is also going to be a great place for you to enter all of the patient's notes so that no matter who is accessing it, they can see what the patient has had done, what records have been kept, and why the patient was seen for this specific procedure. One of the biggest things that I love about this system is that it's going to cut back on a lot of errors. We won't have a lot of missing notes, missing patient charts. Things aren't kind of going to get lost in translation anymore. All you're going to have to do is go into that specific patient's chart. There's going to be a list on the sidebar that is going to say patient notes, radiology, lab, kind of a breakdown of everything that we need, all located in one space. So each time a provider updates the system, in the patient's chart, it will be universal. You can find that information in any office, which is going to be super nice as far as transferring records. As far as for the patient, this is going to be a very resourceful spot. It's going to be sort of a patient portal they can access on their phone, their computer, their tablet. It's very easy to work. They're going to get a link sent to them after patient registration is done through the portal that is going to give them a prompt to create a username and a password. At that first visit, we will take a picture that will attach to their patient file, so you always know who you're seeing, who you're speaking with, and who is standing in front of you, so you can verify that you're working with the correct patient. This will also give a very easy access point for our patients. This is going to allow them to see their lab results through this portal. They can go in and access if it's non-emergent. If they come in and have their iron levels tested, let's say, as long as you as the provider are not seeing a huge issue, you can post this on the portal, shoot them a quick email, let them know, hey, I posted everything, it looks good. Any questions, give me a call. But then the patient always has that available to them, as well as if they have any questions, they can shoot you a message back saying, hey, just wondering why this looks this way, or do I need to follow up with you? It's a great resource for them. You can also send them some informational videos and links. We can also include in there anything that we need to educate the patient further. The other super nice thing is that not only are we going to be using this for emails, but we can also send out text reminders, especially with the administrative staff. Text reminders stating, hey, you've got an appointment on Monday the 5th at 2 o'clock. Please reply yes to confirm, which cuts back on a lot of our phone calls and kind of gives everybody a little bit more advance notice to confirm their appointments. Patients can also send pictures, especially with little kiddos. We'll get a picture saying, hey, does this rash look weird to you? Is this something I need to be seen for? Provider or their nurses can take a peek at it, shoot a message back, say, yes, please call our office, or no, that should go away. Here's what we can do, just as a kind of way to help everybody out in their busy lives. There's not a ton of long-term data that states that this is, the best thing ever, but everything that you're reading up on is going to tell you that patients think that this significantly helped with their busy lives, that they can get everything in one place, all of their doctors can have records transferred quickly and easily through this electronic system, and that they can just access it so quick and so easy. So I think that we're going to see a lot of positive feedback on that. Another really great part of this is that we are able to do telemonitoring and telehealth with our patients. So, for example, right now with all this worldwide pandemic that's going on, we are still able to see our patients virtually through these videos. You can kind of have a discussion of, okay, is this non-emergent? Is this something we can talk through on the phone? Or is this something that you actually do need to come into the office for? The telemonitoring is also going to be really great because it gives you a chance to monitor different things through the patient portal, allowing the patient to just kind of communicate with you via the internet. Another great thing is that we can send all of the requests through, and it happens immediately. I know that I touched on that before, but for patients, it's really nice that they are able to have it all in one location, and that you can chat with them virtually and say, hey, Jane Smith, I'm going to send your radiology results to you right now, and your doctor will give you a call to discuss them in the next 10 minutes. Let's set up an appointment so that we have it on the books. You can set up these telehealth appointments as if it is an actual appointment through this system, so that the doctor knows that at 10:30 tomorrow morning he has a call with Jane Smith to go over her results and let her know that she needs to come in for a follow-up and another scan in 3 weeks, which is going to be really nice. The other really nice thing I kind of want to touch on that you'll really find, I think, useful as well, is that all of this patient information stored in their portal will alert you when you open up the patient's screen. It will say, hey, they are allergic to amoxicillin and penicillin, etc., so that you are able to have a heads up prior to prescribing medication, going in there, oh, they've got a latex allergy and they're allergic to amoxicillin, so that you have no risk for error or anything like that. Not only is this going to give you the patient's medical records, but if transferred into the system, we can have access to patients' dental records as well, as not just medical x-rays, but we also will get access to dental x-rays, any of their vision screenings, etc., and any notes that have come from previous doctors that we can apply towards this. So, like I had previously stated, this is going to be a big learning curve for everyone, and my door is always open. Let's use this as an opportunity to better our patients' health and experience with us. I think that this going forward is going to be very, very good for the hospital, the staff, and the patients. My door is always open. My contact information will be included in the email, but my personal email to go ahead and get a hold of me is going to be jndobbs@comcast.net, and my phone number is going to be 303-416-0410. You can find me on the 3rd floor of the hospital. Just ask the desk and they'll shoot you down to my office. If you have any questions, please feel free to ask, but this is going to be really good for us, you guys. I'm looking forward to it.